Hello, good afternoon. I will be your housing keeper today for this webinar, Trauma-Informed Services for Survivors of Sexual Violence in Connecticut. I will present today. It's Kelsey Alexander, Training and Prevention Coordinator for the Connecticut Alliance to End Sexual Violence. Next, please. So I just want to share with you, this presentation was prepared for the New England MHCC and the cooperation with SAMHSA. So at the time, Dr. Nita Dolphin serves as Assistant Secretary. Here it's your grant number, but all the presentation, the responsibility is Kelsey, not SAMHSA. Next, please. So at the MHCC, you use a forming, respectful, and recovery-oriented language in our activities, and that is the language that you use. So that will be available for you tomorrow at our web page. Next, please. So I would like to thank you, Kelsey, again, and the floor is yours. So if you have any problem with your Zoom, please contact us, send a message to the chat. We are here to support and help you. So this webinar is recording and you'll be available at our webpage tomorrow with the PowerPoint. If you have any further questions, please contact Kelsey and contact myself and MHCC. The information will be available for you too. Enjoy the webinar. Thank you so much.
Everyone. So as Gracie said, my name is Kelsey Alexander, and I work for the Connecticut Alliance to End Sexual Violence, which is Connecticut's statewide coalition. I'm going to just jump ahead to the next slide. We'll come back to this definition in a second. The Alliance is Connecticut's statewide coalition of anti-sexual violence agencies, or you may hear them referred to as rape crisis centers or sexual assault crisis centers in the state of Connecticut. So we, the Alliance, we do provide a little bit of direct service, but for the most part, we are supporting these 9 sexual assault crisis centers that exist around the state and that serve different regions of the state. And on our end, the place where I work, we're doing more training, such as what I'm doing here today with you all, training professionals who might be working with survivors and victims of sexual violence on how to best support folks and to provide trauma-informed services to people. We do policy legislation. So whenever there is legislation being proposed that would affect survivors in some way or would make it easier or harder for us to do prevention of sexual violence, we have a team of folks who are working at the Capitol and lobbying for legislation. And we just really try to support all of the advocates and counselors in the state that are working directly with survivors of sexual violence. So that's where I'm coming from. I am going to tell you a whole lot more about the services that these centers are providing. But before I do that, I want to just come back to our definition of sexual violence, because while I'm guessing all of you here today have some idea in your head of what sexual violence is or what sexual assault is, the definition that we use at the Alliance and that all of our member centers in the state use is much broader than I would say, if you are familiar with what is a legal definition of sexual assault or sexual violence, or, what do the police consider to be sexual assault or something like that. So I'm going to read the definition on the screen here and then sort of break it down a little bit for you all. So the first paragraph says, sexual violence is any unwanted contact or non-contact sexual acts or behaviors. Sexual violence describes a range of behaviors carried out with the use of coercion, manipulation, threats, intimidation, force, or abuse of power. Sexual contact without affirmative consent is sexual violence. It is never the victim's fault. So let's talk about that for just a second, and then we'll get to the second paragraph on the screen here. So the first sentence, I think, introduces an idea that might be a little unfamiliar to folks, which is that some types of sexual violence are non-contact acts or behaviors. So they don't actually involve touching someone's body. So what that might be is taking a picture or taking a video of someone without their permission, sending someone sexually explicit pictures or videos, or even just, verbally like harassing someone or saying things to someone that make them feel really uncomfortable. Any of those things are considered sexual violence, along with the more obvious, all of the like physical contact types of behaviors that somebody might do, right? And even within that category, there's really a whole range of things. I think, the media, the news, television shows have for a long time really focused on rape and on, this like very violent, really terrible type of sexual violence. But there are many, many other ways that somebody, essentially anytime a person is touched in a sexual way that they have not given permission for, we at the Alliance and all of the anti-sexual assault agencies in the state, we would consider that to be sexual violence. So if you were working with a person or know a person who's had any experience that fits into this definition, they are welcome to receive services from any of the anti-sexual violence agencies in the state. And when in doubt, I think a lot of times people have experiences that they don't totally know if it would be considered sexual violence, or they don't know how they feel about it. It's always okay for someone to call our hotline, to speak to an advocate, to talk about what happened and talk about how they feel around it. That's not them committing to doing anything or agreeing to speak to somebody regularly or to make a police report or do any of those things. It's very, very normal for people to just call because they have questions about something that happened to them. And I'll make sure you all get our hotline number. That is the easiest way for folks to get connected to our services. So I want to talk for a second about the second paragraph on the slide here, which says, on the societal level, sexual violence is the preponderance of attitudes, actions, and social norms that perpetuate and sustain environments and behaviors that promote cultural tolerance, acceptance, and denial of sexual assault and abuse. Sexual violence violates a person's trust, autonomy, and feeling of safety. So the reason I include this definition or this other idea around sexual violence is because I think it's really important to know that all of these different types of behaviors, all these experiences that people have, they don't happen in a vacuum. They happen in a very specific context, which is that we live in a world, we have always lived in a world that has tolerated some level of violence and some level of sexual violence specifically. And we see that not only in the crimes and the experiences that people have in their relationships or out in public or, all the places that these things happen. But we see that reflected in the media, in things that are considered to be acceptable, like our cultural norms around gender and, all these different things that sort of communicate that on some level, we just sort of expect like some amount of violence to be happening to people. And all of those things are also impacted by the fact that we live in a world, we live in a country where there is racism, where there is transphobia, where there is classism, where there are, all these other forms of oppression that really layer on top of this level of violence that we also have happening in our communities all the time. I often say that if we think about, I come from a public health background. So if we think about in terms of like public health language or folks that in the public health world might use to describe the problem of sexual violence, it would be very appropriate to use the word endemic, meaning that sexual violence is happening everywhere in all parts of our world, all the time at high rates. So it's not something that, comes and goes in waves. There's not a particular season where it's happening more often or a particular place where it's happening much more. It's happening everywhere, all the time, to all kinds of people at high rates. So having that in mind, I'm going to talk a little bit about the services that I use the language member centers. When I say that, I'm talking about the 9 anti-sexual violence agencies in Connecticut, the services that they provide, as well as just who is experiencing sexual violence. I'm going to give you all some data on prevalence and, prevalence among different communities that may be relevant to the folks that you're working with. So bringing us back to this map, I hope you all take a second and wherever you are based, or, the folks that you work with most often, like wherever people live, take a second and look at the different catchment areas for our 9 member centers and figure out which one, or maybe 2 or 3, depending on where you are, which ones you might be referring people to or want to know about most, because that's who's relevant to you. That being said, it's also totally fine to not know which agency you might want to refer someone to based on the town that they live in, because the great thing about sexual violence services in Connecticut is that we just have statewide hotlines that people can call and get connected to the right place. So even if, if you were working with a person from Litchfield and you don't remember that the Susan B. Anthony Project is the organization that serves Litchfield and some of the other towns around it, that's totally fine, because you're going to give that person the hotline number. If they were to call the hotline, they will then get connected to the Susan B. Anthony Project. So it's totally fine to not be an expert on all these agencies around the state. The other thing I want to say about our hotlines is that we have one in English and one in Spanish. The English hotline is also available for text. So if somebody just texts that 1-888 number on the top of the screen here, they will get connected to an advocate and be able to go back and forth over text with an advocate. The texting is only available from 9 to 5 because it's a pretty new program that we're rolling out. So it's not available 24/7 the way that our regular 2 hotlines are. If somebody texts that number at, midnight or whatever, they'll get an automated message that says, this number is not currently being staffed. It'll start again at 9 a.m. And in the meantime, if you wanted to call the hotline, you could call this number. So they will get a response no matter what, but they won't actually get to talk to like a live person at that point. We also on our website have a chat feature that functions exactly the same way as the texting option. So it's from 9 to 5. They can message over the website and talk to an advocate. So we have the Spanish hotline you can see at the top of the screen here. If somebody speaks a language besides English or Spanish, they should call the English hotline, indicate what language they speak, and the person, the advocate that answers the phone will use language line or another translation or interpretation service so that they can speak with somebody in the language that they need to be able to communicate in. So really anyone, any language should be able to have a conversation with an advocate using one of these 2 hotlines. So some of the other services that are offered by our member centers, they're all listed over here on the side. I know it's probably a little small, but I'm going to take you through all of them. So all of these services are provided by certified sexual assault advocates and counselors. So everybody goes through a really intensive 40-hour training where they learn all about the dynamics of sexual violence, of trauma, about not only the services that their agency provides, but lots of other services in the community that they might need to refer someone to. They learn how to do crisis counseling. They learn how to help ground someone if somebody is feeling like they're, in the middle of a crisis and having a hard time talking about what's happened to them. They learn all about the different systems that victims and survivors often have to navigate. So the police, the court system, the hospital, medical system. So anytime someone calls the hotline, or if they make an appointment with an agency, if they want to come in and have a counseling session with someone face-to-face, or many of our agencies are doing appointments virtually still, all of those things are going to happen with a certified sexual assault crisis counselor. So the hotlines are available 24/7. As I said, all of these services are confidential. So that means that in order for there to be any communication or any sharing of information about someone from one of these agencies, potentially to, maybe somebody is working with a case manager on getting new housing. We see this happen sometimes because maybe somebody is living in an apartment building and the person who assaulted them lives in the same building. So now they need to find new housing as well. They don't feel comfortable continuing to live in this apartment. So maybe they're working with a different organization to find new housing, but they want to have their housing case manager and their counselor from the Rowan Center or from YWCA. They want to have those people talk to each other and sort of coordinate and figure out the best plan to move forward. They can do that, but everything is going to need to be signed, a release of information, because we take confidentiality really seriously. So all of our member centers do short-term crisis counseling, both for individuals and in a support group type setting. So this is different from like a long-term therapy situation that somebody might be in. Certainly our centers do a lot of referring, and they get people connected to therapists in the community if that's what they're looking for. But this crisis counseling is more for getting somebody back to baseline, getting them to a place where they feel like they have a plan to move forward. They have some sense of like the decisions they want to make, potentially around talking to the police or getting medical attention, or any other systems, as I said, that can be really challenging to navigate and to know what all of your options are within those systems. So our advocates and counselors are sort of helping people navigate all those systems, and it's for a time limited period. So depending on how often they're meeting with someone, it may be 8 weeks, it may be 12 weeks, but the goal is not that it is a long-term therapeutic solution or process for this person. But so they're providing this counseling. Many people work individually with a counselor or an advocate, again, in person or maybe over Zoom. They also offer support groups, and depending on the agency, they offer different kinds of support groups. So sometimes they'll have ones that are just for men, or just for people who speak Spanish, or LGBTQ specific support groups for people of different ages. So many of our centers are offering multiple support groups at different times. If you do work in an area where it's easy for you to identify, oh, this is the agency that I would likely be referring people to, it would be a good idea to maybe call them and just get a sense of like, oh, what are you all offering right now, so that you know what you could refer someone to. Our member centers also provide a big chunk of the services they do are accompaniments. And so that might be to the hospital, to the police, or through a court process. So what that means, the hospital accompaniments are actually, this is part of Connecticut state law. So anytime somebody goes to a hospital in Connecticut and either requests, or maybe, through conversation with a doctor or a nurse, it feels like this person maybe should get a sexual assault forensic exam, which is the evidence collection exam that people sometimes get, or you'll sometimes hear it referred to as a rape kit. Anytime somebody goes to a hospital in Connecticut to receive a rape kit or to have some sort of exam done because they've been sexually assaulted, the hospital will call whoever the local member center is and request that an advocate come to the hospital right away. Now, the patient doesn't need to speak to the advocate if they don't want to, but the advocate will be there. It will be presented to the patient as an option if they want to talk to the advocate before the exam, if they want to have them be present during the exam, if they just want to have them be there in case they have questions. That can just be really helpful for folks. Unfortunately, these types of exams often take hours and can be really, really exhausting and difficult for patients who are survivors. So, it can just be helpful to have someone there to say, here's what this exam is going to be like, and here's what you could expect. And here are the things that you could say, yes, I want to do this, or no, I don't want to do this. Here's what might happen. If you go through the exam and you have it submitted for testing to see if they get a DNA hit on any of the things they collected, here's what would happen with that. So again, advocates are doing a lot of just answering questions and helping folks sort of navigate different systems and services. And sometimes that means doing, actual advocacy on behalf of the survivor in one of these settings. So, once I had a colleague tell me that she responded to a hospital call for a young woman over the age of 18, not a child, who was going to have this exam done, and a bunch of her family had shown up at the hospital and were sort of sitting in like the waiting room of the hospital, but they were saying like, we want to go see our daughter, sister, whatever their relation was to her, like, we're here, we want to go be in the room with her, and the advocate asked the young woman, like, do you want me to bring any of your family members in? And she said, no, I don't want them to come in here. I just want to do this. Like, that would be too stressful for me. I don't want to talk to them. So then the advocate, in conjunction with some of the medical professionals, was doing some advocacy saying, we don't want to let you in there. She doesn't want anyone to come in. And this is what she has decided. This is what's going to be best for her. So, you can wait or you can leave, and that's what we're going to do. Right. So sometimes situations come up where we actually just have to do some advocacy right in the moment. So then I mentioned that there's accompaniment also when it comes to the police or the court system. So if somebody decides that they want to make a police report about something that happened to them, or they need to apply for a protective order or a temporary restraining order, advocates can help someone do any of those things. So they can not only talk them through, like, this is what that process might be like, or here's what might happen if we do that, but then actually literally go with them to the police station, or if somebody does end up having to do like a court process and show up to court, they can have an advocate be present with them to, in some cases, like, speak on their behalf. Sometimes, people have to decide that they want to participate in an investigation and have something go to court, but really don't want to have to speak in court very much. And that's fine. Then advocates can help them with that. I'm going to just pause for a second, because I know I've been talking a lot, to just see if anybody has any questions at this point. You can use the chat, you can unmute yourself, anything is fine. All right, we'll keep moving. Also, I should have said this at the beginning. I'm a pretty casual presenter, and it's totally fine if at any point you have questions to just unmute yourself, or to if you want to use the raise your hand option, that's fine. But you can really feel free to just start speaking or to put something in the chat. All right, so I think it's helpful to get a little bit of context for, how many people is this happening to? How many people are seeking services? What is the prevalence of sexual violence, not only in Connecticut, but in the entire country, or what are we talking about? So this is a little bit of data from our member centers. So just in terms of the number of people that were served, this is for the fiscal year 2020 to 2021. So we have actually seen pretty steadily, as it feels like we're in a whole new phase of COVID right now. I know numbers of cases are going up again, but as we were seeing like a decrease in COVID, we were starting to see like more people pretty consistently every quarter coming into our agencies or calling our agencies. But so some of the data that's on the bottom of this slide says that the Alliance, meaning all of our 9 anti-sexual violence agencies, served nearly 7,000 clients in the last fiscal year. And that includes About half of those clients attended individual counseling sessions, and they did about 700 hospital accompaniments. And this number, the 709 number, is pretty low for an average year of hospital accompaniments, because this fiscal year that we're talking about was during, a pretty significant part of COVID. And many people were not going to the hospital for things that they normally would go to the hospital for, because it just didn't feel safe to go into a hospital. So this number, I'm sure when we look at our next year's data, is going to be much higher. So the graph that I have on the slide here, I just think it's really interesting to show by age the types of the people who are coming to our agencies and receiving services, because it really drives home the point that we're not just working with adults, we are working with many children. So this graph shows us the ages of different clients that we see. Obviously, this 25 to 59, this is a really big range of ages. So of course, the number is going to be really high. But if you notice, compared to some of these other, anybody under the age of 24 or even under the age of 18, we're working with a lot of young people, a lot of children. And I'm going to give you some data in just a minute that shows you why that might be the case, like the prevalence of young people that have experienced child sexual abuse. But I wanted to highlight this because this is a really significant population of people that we work with. And if a young person has experienced child sexual abuse and gets connected to one of our agencies, maybe they come in for counseling, or they, through filing a police report or going through a court investigation, they get referred to one of our agencies. There are services available not just for the child, but for the whole family. We know that any survivor of child sexual abuse, the harm that has been done to them, it doesn't just stay with them. It affects everyone around them. It affects all the people who care about them. And unfortunately, because most sexual violence is done by people who are not strangers, who are people that are known to the victim or the survivor. In the case of child sexual abuse, this does include family members. It includes family friends, neighbors, friends, people that are in someone's life. And so that can be a really devastating experience, obviously, for the child and for other people in the family who are sort of grappling with, how did this happen? And this person that did this thing is someone that we trusted, and I can't believe that this happened. So there is counseling and support available for all of the people. It's not just for the child, but we do work with a lot of children. And we work with a lot of adults who had an experience of sexual violence as a child and are just now, as an adult, seeking some support for that. All right, so now I'm just going to sort of run through a bunch of data that illustrates how common sexual violence is. So the first bar up here, this is just our general prevalence of sexual violence broken down by gender for the United States. And globally, the numbers are basically the same, although we really don't do a great job collecting data on men in other countries or around the world. We didn't do a great job collecting data on men in the United States either until recently, but the numbers we have are that 1 in 3 women and 1 in 6 men are victims of contact sexual violence at some point in their lives. The thing that I find really interesting about these numbers, or I think is surprising to a lot of people about these numbers, is that they're not that far apart, right? I think we have framed sexual violence as something that only affects women for many, many years in the United States. And we've started to see that that's not really the case, or, many of us know that that's not the case, and our national conversation is shifting a little bit. But I think many people are surprised to hear that the percentage of men who've experienced sexual violence is not that much less than the percentage of women. So then when it comes to children, I mentioned that we work with a lot of kids in Connecticut. The numbers are that 1 in 4 girls and 1 in 13 boys will experience sexual abuse sometime before they turn 18 years old. So again, I find these numbers to be pretty shocking because they feel it just feels really high when we think about the number of children that we know, right? But unfortunately, it is as common as they're saying. And I don't have the numbers in this presentation, but if you're familiar with the youth risk behavior surveys that we do in Connecticut, they do them every year with high school students. They do them in lots, I think all the states around the country. And they're surveys of high school students that ask questions about lots of different like health behaviors, risky behaviors that they may or may not be engaging in, around drug use, alcohol, driving safely, all kinds of things. And they do ask a few questions around if a young person has experienced some form of sexual violence in their lifetime. And so we do actually have a little bit of Connecticut specific data. I'm just sort of pulling these numbers out of my head, but I believe that for just when you ask the question, if a young person has ever been sexually assaulted or raped, might be the language they use in the survey, among high school students, about 6% or somewhere around 6 to 8% of girls answer yes, and 2.5% of boys answer yes. The number's about double when you ask them, have they ever experienced sexual violence in the context of a dating relationship? So when you ask, has your partner or anyone that you've ever dated ever done something sexually abusive to you? For girls, the number goes up to about 16%, and for boys, it's about 9%, or maybe a little less than that for boys. But so anyway, even in Connecticut, we have a little bit of data showing that there are many, many young people affected by this problem. I'm seeing some questions come in on the chat, so I'll just address those right now so I don't forget. So I'm going to answer the easy ones first. So can people report anonymously is one question that I got. So it depends on what type of report. People can certainly call the hotline and not give their name if they want to just talk about something and they don't want the advocate to know who they are or to collect any information about them. That's totally fine. They can report anonymously. Any information that gets reported will be kept confidential. Our advocates are mandated reporters, so that would be the only situation in which a person may want something to remain confidential, but the advocate obviously needs to follow through on mandated reporting if they think that a young person or an elderly person or anybody who falls into that category is at risk of being hurt. That being said, we do, I'm sure, get phone calls from teenagers potentially who are describing something that might be worthy of making a mandated report, but the teenager might choose not to give their name or not to give any identifying information. And so you can't make a mandated report if you don't have that information. So I think that's one way that young people who know that the person they're speaking to is a mandated reporter are sort of choosing to withhold a little information so that a report can't be made. So the other question that I got is, what are a person's rights as an abuser, and what are a person's rights as someone who suffers from sexual abuse? So our agencies don't, with the exception of one, I'll tell you about one department at the Alliance that does do a little more work with people who have been convicted of some form of sexual violence. Obviously people, if somebody is being accused of doing one of these things, they have the right to have a trial about it, to go through a court process to prove if they did do this or not do this, and to have a lawyer and to be advised on how to handle that whole situation. We at the Alliance and our member centers don't do a ton of work with the people that are doing the violence. There are some, I know there are groups around the state that people sometimes get assigned to do or mandated to do as part of, potentially going through a court process or the consequences of what they've done. They need to attend this 12-week group to learn more about the dynamics of sexual violence and to build empathy for victims and survivors and things like that. In terms of the rights of someone who is a victim or a survivor of sexual violence, from our point of view, obviously they have the right to all of the services that we are providing. All of these services are free. They have, from more of like a philosophical point of view, they have the right to be believed by the people in our agencies and the people that they're working with. That's, the police and the court system, like their job is to investigate something and to prove if something happened or not, right? That's not our job. Our job is to say that, this person has come to us, they have had this experience, they're telling us about it, they deserve support. They deserve to have someone say, I believe you, you are welcome here, I will support you, I will provide whatever services I can to you. So that's really fundamental to the way that we do our work. People have the right to, if they want to receive medical care for something that has happened to them. Sexual assault forensic exams in Connecticut are free. A person doesn't need to have insurance. They don't have to pay for anything associated with that exam. If they go to the hospital and say, I think I've been sexually assaulted and I want to have this exam done. There's probably other rights that I'm forgetting. There's a whole other set of rights for like students, college students in particular, or high school students that have experienced sexual violence in the course of, living on their campus or going to school. Title IX protects the rights of people in their education. So, a student at college or in high school may be able to get things like, change the place where they live to a place that feels safer for them, or change their class schedule so that they don't have to be in class with somebody who has done something to them, and have the right to have that whole thing investigated as well. There have been a lot of changes to Title IX under the last administration. So I think, unfortunately right now, Title IX doesn't feel as protective of young people as it used to. But there are people do still have rights on their college campuses and in their high schools and middle schools. All right, I'm going to keep moving. Please definitely feel free to keep sending questions via the chat, and I'll just address them as they come up. All right, so just to give you a little bit more data, this first column, I know saying people of color is a really broad category. We in the United States really don't do a good job of researching like really specific communities when it comes to race and ethnicity, and collecting really good data on the prevalence of violence against people from certain communities. The numbers that we do have show that there is a slightly higher rate of sexual violence among American Indian and Alaskan Native women and among multiracial non-Hispanic women. Similar to how we don't collect great data on people who are not white in the United States. The queer community, has been more of a push to try to collect some data specifically around sexual violence, but this is really a largely understudied community. But the numbers we have show that about half of bisexual women have experienced rape, and 40% of gay men and about half of bisexual men have experienced sexual violence other than rape at some point in their life. A specific segment of the queer community, the transgender community. So this graph, this is talking about high school students. So you want to look at this third and fourth column. This comes from the Youth Risk Behavior Survey that I mentioned earlier. This is not specific to Connecticut. This is from, as it says, 10 US states and 9 large urban school districts. Transgender students are represented by the red bars. So we can see that the rates of violence, specifically sexual violence, are much, much higher than their cisgender peers. And among all transgender people in the US, not just high school students, about half report experiencing sexual violence at some point in their lifetime. So the last population that I just want to draw attention to, I know this is a little bit blurry, but people with disabilities experience much higher rates of sexual violence than people who are not disabled. So the top graph here breaks it down by people with intellectual disabilities, a person with any disability, and then people with no disabilities. And you can see that the rate almost quadruples from people with no disability up to people with intellectual disabilities. This is just a really vulnerable population for a lot of reasons. Many people, depending on the disabilities they may have, are not believed when they report that somebody has harmed them. They may be living in places where they're made even more vulnerable due to just like the setting that they live in and the people they're interacting with there. I was having a conversation the other day. We're setting up a training for a company that operates a bunch of buses out of the Waterbury or the Danbury area, somewhere in that part of the state. And they were saying that, you know, they want training because they know they work with a lot of people with disabilities who use their like their van service to get to doctor's appointments and to get around and stuff. And they know that there are people that have been assaulted basically while using the public transportation, and they're trying to do something about that. So this is just a really vulnerable population that we should be doing a lot more work with. All right. So I sort of talked us through all of this already. These are the services that our member centers provide. So I think the only things maybe I didn't say is that the anti-sexual violence agencies in the state, many of them have bilingual advocates, which often means a person who also speaks Spanish. But some of them have people that speak other languages as well. So somebody could have potentially, ongoing like counseling sessions with somebody who speaks their language. Many of our centers also have male advocates. If somebody would prefer to speak to a man, they may have the option of doing that. And our agencies do a lot of prevention and awareness programming in the communities that they're based in. A lot of this looks like working with school systems and going into classes and talking to young people about boundaries and consent and social emotional learning and things like that. A lot of this is happening on college campuses as well. But they're really just, we're really trying to prevent as much violence as possible from happening. So we have a lot of wonderful prevention educators around the state. So there are two parts of the Alliance, the place that I work for, that are providing more direct services to people. One of them is we have a team called the Victim Rights Center of Connecticut. And this is basically a team of attorneys who are providing free trauma-informed legal services to primarily victims of sexual assault, although they do work with folks that have experienced stalking, hate crimes, elder abuse, sexual harassment, students that have had Title IX discrimination, things like that. So this program that you can see at the previous slide, there's like a little bit of history about how they became part of the Alliance. But really what's most important for you all to know is just that this team exists. And so if you knew of someone who needed legal help as a survivor of sexual violence, these are some of the areas that they provide help with. So folks that are looking for protective orders, folks that are experiencing like discrimination or issues around employment or housing as it's related to being a survivor of sexual violence, so I gave the example before of somebody might need to change their housing because they live in an apartment building with somebody who has harmed them. And maybe their landlord is, maybe that means they need to break a lease and their landlord is saying that they're going to sue them, or maybe somebody's getting evicted for whatever reason, So those types of cases, our Victim Rights Center of Connecticut can sometimes support clients and provide free legal services to them. They are a very small team of attorneys, so they certainly can't take every single case that they receive a referral for, but they try to work with as many people as they can. And these are the areas that they work in, so it's almost the entire state, but you'll notice New London County is not on this list, but most of the rest of the state. I'm just looking at some more questions that have come in. So one is, does HIPAA apply to sexual assault? Yes. So if somebody tells their doctor or medical provider that they have been sexually assaulted or have had some experience of sexual violence, that would be considered confidential the same way anybody else's medical records would be, obviously with the exception of anything that would fall into a mandated reporting situation. And I got another question that's how how might confidentiality influence whether a sexual assault victim accesses health services or not? So I think there is a lot of fear, and just because, you know, we haven't done a great job educating people about the fact that these things can be kept confidential. And so somebody might feel like, well, if I don't want to go to the doctor. I'll give you an example because I've been doing all these trainings around the state with gynecologists and OBGYNs on how to better work with survivors of sexual violence. So they obviously see a lot of people that have had a lot of different experiences. And there's, you know, just given the numbers of the rates of sexual violence, we know that there are many, many people going into their gynecologist office having been sexually assaulted or had some experience in the past. And there are many people who are avoiding going to the gynecologist because that experience feels really triggering and scary to them. Maybe they feel like they're going to be forced to talk about this and they don't want to. So the educating that I'm trying to do of all these doctors and health providers that I'm seeing around the state is to give people this knowledge around like what works for survivors and what doesn't, right? That we don't want to force someone to talk about something. Yes, it might be part of their medical care. You know, somebody may have, even if something happened to someone when they were a child, it could still have an effect on them as an adult and their sexual and reproductive health. So certainly we want to have a conversation, you know, we want people to know that they can talk about it to their doctors, but that they don't have to. But I think it does prevent some people from seeking care because they're worried, like it's the same thing with mental health care and with therapy as well, right? That I do know of lots of survivors that have had not great experiences with therapists because maybe they do tell their therapist, you know, I had this experience recently or a long time ago, and then the therapist makes them talk about it or really wants them to talk about it a lot, which might not feel helpful to them or doesn't feel like something they want to do right now, right? So we take a what's called a survivor-centered approach, which I'm going to have a slide about in just a few, which is just saying, you know, what feels most helpful to this person in this moment. And you know, I might have my own opinions about what would be helpful for them, but that doesn't matter, right? As a service provider, it's just what does this person who's in front of me need? All right, so that is the Victim Rights Center of Connecticut. I will make sure that you all have our website and there's some instructions on there if somebody wanted to get in touch with VRCCT. The easiest way really is to just call their office which means you would leave a voicemail, that it goes right to a voicemail, and then either have someone call you back and they'll do an intake over the phone, or leave a voicemail that includes your email address, and then they will send you the referral form or like the intake form. So somebody could fill that out on their own and send it back. So that's sort of how people get in touch with VRCCT. So the last team that works at the Alliance that is providing some direct service, it's probably unlikely that you all would be doing like any referral to this team, but just so you know they exist, this post-conviction victim services team. So if somebody has gone through an investigation and you know, potentially there's been a trial, or maybe there's been a plea agreement, and someone has been convicted of some type of sexual violence, often that person is on the sex offender list for the state or the registry for the state. They are then typically required to attend groups or obviously somebody might be incarcerated for some period of time that, you know, depending on what happened, there's a whole range of potential consequences here. The post-conviction team supports survivors who are needing communication between, you know, they need to communicate to the probation office or the parole office, or they need to know when is this person going to be released and back out in the community. They really are, this team is providing a voice for survivors in lots of places where people are making decisions about what is going to be the safest plan for someone to go back into the community. Like, where can they go? Who do they need to check in with? What's going to help the survivor feel safe? All right, so I talked about some of this stuff already. Just the role of our advocates, wherever they are. If it's somebody at one of our member centers, if it's our post-conviction team, if it's our team of attorneys, these are some of the basic things that they're doing. Answering questions about systems and processes, providing lots of resources, referrals, and information about, whatever other services someone might need, but also, well, this is what might happen if you decide to make a police report, this is what might happen. Or if you decided to go to the hospital, this is what might happen. All of this is helping survivors make informed decisions. So our advocates are never making decisions on behalf of a survivor. It's always up to the person themselves. But advocates are providing whatever information they can to help that person feel really confident with the decisions they're making. I mentioned they're providing crisis counseling, and really just trying to help people sort of come back into balance and feel a little more normal, so that they have some path forward, even if that means, they're going to have maybe a more long-term therapy relationship with somebody else. And then the other strategy, or the other philosophy that we apply to all of our work, is called survivor-centered advocacy, which is putting the needs and the priorities of the survivor front and center at all times. So as I mentioned before, this is where advocates are not expressing their own opinion about what the right thing to do is or the best thing to do is. They're leaving it up to this person who's in charge. The image that we use, these are some of the values in line with survivor-centered advocacy. So being really, obviously, upholding this person's dignity and having great respect for them and their experience, providing access to lots of options, being really transparent and reliable, following through, communicating really clearly, saying if they're going to do something for someone, really making sure that they do it. Belief and non-judgment. So it doesn't matter what has happened to someone, there is never going to be judgment from one of our advocates, particularly any sort of victim blaming or implying that this person is responsible for what happened to them in any way. Trusting survivor knowledge and the decisions that they make, and then upholding safety at all times. So we do a lot of safety planning, making sure that somebody has whatever they need to feel safe at their job, at their school, when they're out in the community, when they're at home, just talking through what that might look like and feel like. And really in line with survivor-centered advocacy is providing trauma-informed care, which I'm sure is something you all are familiar with, and has many of the same values that survivor-centered advocacy does. But just to reiterate, so we know that all survivors have some level of trauma, and that these 6 values are really the best way to work with people. So the last thing I want to leave you with today is just the benefits of working with an advocate, the benefits for survivors, for being connected to somebody from one of our member centers. So we have a little bit of data, both on victims and survivors themselves, but also on, when organizations partner really well with their anti-sexual violence agency that's in their community. So victims and survivors who work with an advocate are more willing to seek further services than victims and survivors who do not. So about 1/3 of folks who speak to an advocate are more willing, those folks end up, maybe also finding a therapist, also making a police report, also getting a case manager to help them get insurance or something like that, right? This number is much higher than folks who don't. We just know that these systems are so confusing and so overwhelming to people that without somebody to sort of guide them through the process, it just, they just may never seek out services that they're really entitled to. And then organizations who partner closely with their local member center provide better informed referrals. They're able to say, oh, this is what might happen. I'm going to refer you to the Women and Family Center in Meriden, and here's what you can expect when you call this phone number. They have better relationships with victims and survivors are more likely to follow up with them because they have, an actual person that they're speaking to rather than just giving out a phone number and not really knowing what that's going to mean. And they just know more about the options that are available in Connecticut for victims and survivors. So wherever you're coming from, you know, if your organization doesn't have a relationship with your local member center, I would definitely suggest calling them, even if it's just, you know, a phone call to find out a little more about what they're doing. The way that they talk about their services might be a little different than the way I've described here today, because obviously each agency, while they're all providing the same basic things, it is a little different at each place. So I would recommend doing that. All right, so that's it for me. If there's are more questions or comments, please chime in or put them in the chat. And I know there's one more slide on here, Gracie, if we need to go over that one.
Yes, please. So, Kelsey, thank you so very much for this outstanding presentation. So I hope everybody enjoyed as much as I enjoy listening to you. And yes, please, if you have any questions, if you need any further information, please contact the MEHCC. Feel free to contact Kelsey. We'll be here to answer your questions. I would like to ask you to answer our pulse survey. It is important for us. It is important to listen from you, your thoughts, your ideas, and just I'll let you know that this presentation will be available tomorrow in the PowerPoint. Please share and contact us if you have any question. Thank you so much. Appreciate you, appreciate your work, and have a great evening, everybody. Great day, great week. Thank you so much.
Thanks, everyone.